If you wake up with a sore neck, a dry mouth, reflux in your throat, or you keep getting shaken awake because of snoring, your sleeping position is doing more than you think. After 50, the way you place your head, shoulders, and hips can decide whether you breathe well, whether acid stays in your stomach, and whether your back finally calms down. Tonight, I'll show you the best and worst positions, a 10-minute pillow tune-up you can do before bed, and a simple 7-day plan to retrain your body so you sleep deeper and wake clearer. Let's start with a truth that surprises people. There isn't one perfect universal position. There's a best position for your airways, a best position for reflux, a best position for your lower back, and we'll stack those wins together. What matters most is spinal alignment, open breathing, and calm pressure on joints. When those three line up, your brain stays in deeper stages of sleep longer. You move less, and you wake up fewer times. First, a quick tour of what common positions really do to your body. Back sleeping, flat on your back, keeps the spine neutral, but it also lets the jaw and tongue drift backward. If you snore, or your partner says you stop breathing for a second and then gasp, that position makes it worse for many people. Back sleeping flat is also a classic trigger for reflux, because stomach contents can creep up when your upper body isn't lifted. Stomach sleeping, face down with your head turned to the side, forces your neck into rotation for hours. That jams the small joints in the neck and can irritate nerves down into the shoulder and arm. Many people wake with tingling or a stiff neck from this alone. It also flattens the natural curve of your lower back. Side sleeping is the most popular after 45. Done well, it's excellent for snoring and often better for the lower back. Done poorly, arm under the head, chin tucked hard to the chest, top leg thrown across the body. It creates shoulder compression, neck flexion, and a twisted spine that keeps your muscles braced all night. You wake up feeling like you worked a night shift you don't remember. So what should you aim for? Think of a simple hierarchy. Goal number 1, keep the airway open. That means avoiding positions that push the chin toward the chest or collapse the jaw backward. Goal number 2, keep the spine long and neutral from ear to ankle. Goal number 3, reduce pressure points at the shoulder and hips so your body doesn't have to wake just to roll away from pain. With that in mind, here's the winning setup for most adults over 50. Option A, the elevated back position. Lie on your back, but lift your upper body by about 10 to 20 degrees using an adjustable base or a foam wedge under the torso, not just extra pillows under the head. Add a small cervical roll or a towel behind the curve of your neck. This gentle incline reduces reflux, keeps the head neutral, and, for many snorers, lessens airway collapse. If you have sleep apnea, this won't replace treatment, but it's a big assist. Option B, the supported side position. Lie on your side with your ear stacked over your shoulder and your hip stacked over your hip. Use a pillow that fills the space from your ear to the bed so the neck isn't tilting up or down. Place a small pillow between your knees so the top leg doesn't fall forward and twist the spine. Hug a soft pillow at chest level to keep the bottom shoulder slightly forward, which unloads the joint. If reflux bothers you, favor the left side. The shape of the stomach makes acid less likely to creep upward in that position. Here are 3 quick home tests to choose the right pillow height. First, the hand width rule. Sit upright against a wall and relax your shoulders. Measure the distance from the tip of your shoulder to your ear with your hand. That's the thickness your side sleep pillow needs to be when compressed, not in the package. Second, the nose test. Lie down with your pillow and look at a point on the wall. Your nose should line up with your sternum. If your head tilts up, the pillow is too high. If it droops toward the mattress, too low. Third, the breath test. Lie down and take 10 slow nasal breaths. If your mouth keeps popping open, the pillow is probably pushing your jaw backward. Try a slightly thinner pillow or a small neck roll that supports the curve without crowding the jaw. Now, a 10-minute tune-up you can do before lights out to lock in better alignment. Minute 1, reset your chin. Stand or sit tall. Place 2 fingers on your chin and glide the head straight back like you're making a double chin. Not down, straight back. Hold for 5 seconds. Relax. Repeat 5 times. This teaches the deep neck muscles to support your head without curling the chin to the chest while you sleep. Minute 2. Shoulder roll release. Roll the shoulders slowly backwards 6 times, then forward 6 times while breathing out longer than you breathe in. This opens your upper spine so your chest doesn't collapse when you lie down. Minute 3. Doorway chest opener. Stand in a doorway, forearms on the frame, step 1 foot forward, and breathe out as your chest opens. 20 seconds. A tight chest pulls the head forward. An open chest allows easier nasal breathing. Minute 4. Hip sway to neutral. Lie on your back with knees bent, feet flat, and gently sway both knees side to side for 30 seconds. Your lower back should relax into the mattress. This lowers the chance you'll twist hard when you roll. Minute 5. The knee pillow check. Lie on your side and place a small pillow between your knees. Without the pillow, let the top leg fall forward and notice what your lower back does. With the pillow, notice the difference. That tiny gap keeps your pelvis neutral, which means fewer wake-ups from hip pain. Minute 6. The shoulder unload. Still on your side, hug a soft pillow or rolled blanket at chest level. Notice how it floats the bottom shoulder slightly forward so you're not lying directly on the ball of the joint. Minute 7. The wedge test if you sleep on your back. Slide your wedge or adjustable base up just a bit and take 5 slow breaths. If you feel your mouth falling open, lift the chest a touch more and add a small neck roll. The goal is a floating head, not a crane neck. Minute 8. Left side reflux guard. If heartburn wakes you, roll to your left side and keep your torso very slightly elevated with an extra thin pillow under the ribs or a wedge under your upper body. You should feel comfortable, not propped. Minute 9. Nasal priming. Close your mouth and take 6 slow breaths in through the nose, out through the nose, letting the exhale be longer. Gentle, nasal inhaling creates a bit of back pressure that keeps airways more open, and it humidifies the air so your throat doesn't dry out. Minute 10. The sleep shoulder shrug. Once you're settled, shrug the shoulders gently toward the ears for 2 seconds and melt them down for 6. Do 5 rounds. This tiny cue tells your body, we're done holding ourselves up. The bed has us. Let's talk about common mistakes that sabotage good positions. The first is an arm under the head. It feels supportive, but it compresses nerves and blood flow at the shoulder and makes the pillow too high. Keep the arm forward, hugging a pillow, or straight down the side. The second is the chin clamp. Many people tuck the chin all the way to the chest when side sleeping. That narrows the airway and triggers snoring. Keep a fist width of space between chin and chest. The third is the pretzel twist. Upper body one way, lower body the other. It feels like a stretch, but leaves your back guarding all night. Put the knee pillow in place and keep your hips stacked. The fourth is stacking 2 or 3 pillows under the head. That kinks the neck and pushes the jaw back. If you need height, use a wedge under the torso so the angle starts at the ribs, not just the skull. Now the 7-day alignment plan to make this automatic. Day 1 and 2, choose your primary position, elevated back or supported side, and set up the hardware. That means the right pillow height, the knee pillow, and the chest hug pillow. Place a small rolled towel by the bed to use as a neck roll if your pillow doesn't have one. Day 3, environmental cues. If you're retraining from stomach sleeping, place a body pillow along your front, so rolling onto your stomach feels awkward. If you're retraining from a twisted side posture, place a small pillow along your back so you stay stacked. Day 4, habit cue. As you turn off the light, say out loud, stack, support, soften. It sounds silly, but verbal cues help your brain remember what your body is supposed to do the moment you get drowsy. Day 5, micro check. Anytime you wake at night, do a 3-point check without switching on a light. Chin lifted away from chest. Knees gently hugging a pillow. Shoulder not jammed under you. 2 seconds, then back to sleep. Day 6, comfort audit. If a joint keeps waking you, it's not a failure of willpower. It's a signal about pressure. Add a ½ inch of pillow height on the side. Change the knee pillow thickness, or test a softer topper. The right surface removes the reason to wake. Day 7. Move the benefits into your day. 10 minutes after waking, do a simple mobility trio: chin glide, shoulder rolls, and hip sways. The more neutral your posture by day, the easier neutrality is at night. A quick word about special situations. If you have reflux, prioritize the left side or an incline. Avoid heavy meals or alcohol within 3 hours of bedtime. If you snore loudly or your partner hears pauses in breathing, ask your clinician about testing. Better position helps, but if you have obstructive sleep apnea, treatment changes lives and protects your heart and brain. If you wake with pins and needles in the arm regularly, check your pillow height and your shoulder position, and mention it to your provider if it persists. What about mattresses? People over 50 often do best on a medium firm surface with a 2 to 3 inch pressure relieving topper. Too soft lets your hips sink and twist the spine. Too firm creates pressure points that force you to roll. Your shoulder and hip should sink just enough that your spine looks straight from behind when you're on your side. What about gadgets like mouth tape or nasal dilators? If you're a mouth breather without congestion, a gentle nasal strip and a humid bedroom can help you stay closed mouth more comfortably. Mouth tape is a personal choice. Some people love it, some don't. The safer starting point is solving position and pillow first, then addressing nasal airflow with strips or saline rinse. Let's put this together into tonight's plan. 1. Pick your target position, elevated back or supported side. 2. Set up the right height pillow, a knee pillow, and a hug pillow. 3. Take 10 slow nasal breaths to prime your airway. 4. Do the shoulder shrug melt. 5. If you wake up, do the 3-point check and go right back to sleep without looking at the clock. And here's your momentum plan for the week. Write stack, support, soften on a sticky note next to your bed. Do the 10-minute tune-up tonight and for the next 6 nights. On day 7, look back at how many times you woke for discomfort compared to last week. Most people see fewer wake-ups, easier breathing, and a neck that doesn't complain in the morning. Your position is not just comfort, it's a signal to every system in your body. When you align your head, chest, and hips, you make it easier to breathe, easier to digest, and easier for your brain to stay asleep long enough to repair what the day wore out. Try the setup tonight. Tell me in the comments which change made the biggest difference: pillow height, knee pillow, or the small incline. If you want practical, evidence-friendly sleep upgrades every week, subscribe and share this with someone who keeps waking up with a cranky neck. I'm rooting for your next great night.